Imagine waking up one day to find that your health insurance premiums have skyrocketed, leaving you with a daunting decision: pay the exorbitant costs or risk going without coverage. This is the harsh reality that many Delaware residents may face in 2026, as insurers are seeking double-digit premium increases that could be among the highest in the nation. But here's where it gets controversial. The proposed rate hikes of over 30% are not just a result of rising healthcare costs, but also due to the growing use of high-cost prescription drugs and the uncertain future of federal subsidies. And this is the part most people miss. The final rates won't be set until later this year, and the impact of these increases on consumers will depend on various factors, including the continuation of federal subsidies. Delaware residents who rely on the Affordable Care Act (ACA) marketplace are likely to be hit the hardest, with 3 insurers requesting rate hikes of more than 30% for 2026. To put this into perspective, the national median for proposed premium increases is 18%, which is already the largest requested rate hike in nearly a decade. The proposed increases in Delaware are significantly higher, with Highmark Blue Cross Blue Shield of Delaware seeking a 30.2% increase, Celtic insurance company Ambetter Health requesting a 31.8% hike, and AmeriHealth Caritas VIP Next proposing a whopping 46.2% increase. While these numbers are alarming, it's essential to note that most ACA marketplace enrollees receive subsidies, which can help reduce the impact of rising premiums. However, if the enhanced premium tax credits expire at the end of 2025, many consumers will receive less financial assistance, forcing them to shoulder a much larger share of the cost. This raises serious concerns about the future affordability of ACA coverage. So, what's driving these higher premiums? The Peterson KFF study points to 2 main reasons: rising healthcare costs and the potential expiration of a major federal subsidy program. The report cites several trends fueling premium increases, including inflation, higher labor expenses, and the growing use of expensive prescription drugs like GLP-1s, commonly used for diabetes and weight loss. A new report from the Delaware Department of Insurance suggests that GLP-1s may not be a significant contributor to rising insurance premiums in the state. According to the department, the use of GLP-1 medications among Delaware's commercially insured population nearly doubled between 2020 and 2023. But the financial impact has been largely offset by manufacturer rebates. These rebates are payments from drug manufacturers to pharmacy benefit managers, who then share all or part of the rebate with health insurers or employers. The report also notes that data on GLP-1 use within the state of Delaware group health insurance plan was not included in its analysis. In the coming months, the department plans to expand its pharmacy spending analysis to include all medications, offering a more comprehensive view of prescription drug costs in the commercial, fully insured market. Delaware's response to soaring healthcare spending is a critical aspect of this issue. Another chief concern is the uncertain future of enhanced federal premium tax credits, which have helped make ACA plans more affordable for many Delawareans. These subsidies are set to expire at the end of 2025 unless Congress renews them. The Peterson KFF analysis found that insurers are factoring the possible end of these credits into their pricing, which could lead to a smaller, sicker insurance pool and even higher premiums. Other contributing factors cited in the report include the rising cost of specialty drugs, hospital consolidation, and ongoing financial strain on healthcare providers. In Delaware, healthcare spending rose 9.1% between 2022 and 2023, nearly triple the state's benchmark growth rate of 3.1%, according to state data. Total spending reached almost $11 billion in 2023, with hospital inpatient care and prescription drugs accounting for the largest share of the increase. To help control rising costs, lawmakers created the Diamond State Hospital Cost Review Board in 2024, tasked with monitoring hospital spending and implementing cost controls. However, The board's authority was quickly challenged by a lawsuit from ChristianaCare, the state's largest health system, as well as funding challenges and leadership turnover. As we move forward, it's crucial to consider the potential consequences of these premium increases on Delaware residents. Will the state be able to mitigate the effects of rising healthcare costs, or will consumers be left to bear the brunt of these increases? We want to hear from you. Do you think the proposed premium increases are justified, or do you believe that insurers and policymakers need to find alternative solutions to address the rising costs of healthcare? Share your thoughts and concerns in the comments below.